Hi, I'm Satya, see me at jensatya.com. In this video, I'm going to talk about some of the challenges that we're seeing around the three main forms of testing that we're doing right now. The first being the PCR testing, and then the two antibody testings that we're doing. I speak more to what those tests are in my testing video. This will really just focus on the challenges we're having around obtaining accurate results. Thank you for listening. I hope it's useful. First, with the PCR testing. The initial issue that we're having with PCR testing is how to actually obtain enough material that we can test appropriately. The PCR testing is a swab testing, and when we swab the nasal cavity or the throat, we're looking to obtain enough material that we can test properly for whether or not you have the virus. To do this, we need to be able to actually scrape pretty thoroughly, especially for those that aren't presenting enough symptoms where there's a lot of the virus in the mucus. If we don't get enough material, then you're going to test negative even if you're sick. And so that's been the main challenge that I'm seeing with PCR tests. The other challenges include getting the material to the lab on time, meaning that there's a window of time that we really should get the genetic material to the lab within in order to test appropriately, and how it's handled along the way can have challenges. And then it's how we're processing your test can also have challenges, and has had quite a few challenges along the way. So all three of those areas of PCR testing can be a problem. One new issue newer issue that's been coming up recently is we are understanding that this particular virus is hitting different aspects of the individual's system. So in one person, they may present with the classic fevers and more respiratory issues, and another patient may present with neurological issues or something else. And we're curious at this point if part of the problem with the PCR test is that it seems to focus more on the respiratory aspects of COVID, and therefore we're not sure if that's the best way to test if someone is presenting different types of symptoms. Another newer challenge that we're seeing now that we understand more is we have what we call chronic COVID cases. And if someone has had COVID for more than a few weeks, we're not sure how valuable the PCR test is going to be for a patient who's been sick that long, or if it may make more sense to utilize other testing for that type of patient. So those are some of the challenges inherent in PCR testing. Now let's look at some of the challenges in antibody testing. Antibody testing for COVID, the number one challenge that I'm seeing is around timing. We want to do the IgM antibody test within the first window of time and the IgG antibody test within the second window of time. And we don't always know when someone got sick, which can cause us to not know exactly when to do which test. And we also are finding that different laboratories have different requirements around when they feel their test will be more effective. So if I have a test from one laboratory saying we should really do the IgG antibody test within 20 to 32 days, and I have a test from another lab saying we should really do this test between 15 and 21 days, or something of that nature, it's going to be very challenging for us to manage that. And so what I'm often seeing with the antibody tests right now is that doctors are running both the antibody tests and the PCR test all at once. And they're just hoping something hits. I just don't think that that's an effective way to do this. And I also think we're wasting a lot of tests. And I'm concerned about the fact of how all that's getting counted as well. Because if I test someone for all three tests and they only show a positive for PCR test, I'm going to need to then test them again shortly thereafter for the IgM antibodies, and again shortly thereafter for the IgG antibodies. And if I'm doing all those tests over and over for the same patient, are we then including all of that testing within our numbers? And how are we discerning within our numbers that we're counting about how many people are sick, whether or not that was all one patient? So we have a lot of inherent challenges here within this whole arena of testing. Two other challenges that we have within antibody testing that I'm going to offer links below on because it's more scientific than maybe is useful in a short YouTube video are around the topics of sensitivity and specificity. So within antibody testing, we want to ensure that these tests are sensitive enough to pick up on if someone has developed antibodies. And we also want to ensure they're specific enough that they are picking up on COVID-19, SARS-CoV-2, and not on a similar virus. And so specificity and sensitivity are important factors in whether or not this testing is useful, and we have found some challenges in both along the way. I hope this video was useful in understanding why many of us in the field are finding so many challenges with these tests, and also why it's really important for your medical professionals to not rely solely on testing if you're proving symptoms and you're feeling sick. As always, I believe the best thing that we can do for our patients is ensure that we're listening to them about how they're feeling and not rely on tests, especially when the testing might not be accurate. Thank you for listening. In good health.